Hi, I'm Jeanette Wedding. I'm the General Manager for Child, Youth, Maternal and Oral Health Services at the Northern District Health Board and also the Lead General Manager. But I want to say I'm really pleased to be able to offer a few comments today in support of Yvonne's presentation on the CCDM project that we had carried out on Ward 2, our paediatric ward. I think when we started off at the beginning of the process, at the time that we started, we were a busy ward, really busy, high acuity, high demand, staff feeling pretty overwhelmed with the workloads, and probably also an ability to get traction on things like equipment and that kind of thing that they needed. So when I look back to when we started to where we are now, in terms of almost a year later, there's been a significant change in that. I'm sure Yvonne's offered you some statistics along the way that can demonstrate some improvements in things like patient care, in productivity, how the staff are feeling on the ward. And I mean, for the first time that I can recall since I took over the service, and that's since about 2004, we have a waiting list of staff who want to come and work in Ward 2, which is absolutely fantastic. I personally can actually feel when I walk on the ward, the total mood change, things seem less stressed among staff, there's processes put in place, systems put in place, and just, you know, a lot more of a supportive environment. Some of the information that I got was from some of the analysis that was done, some of the activity reports, and I'm a person that actually likes to look at things visually. I hate reading a lot of narrative versus actually looking at graphs and kind of challenging, you know, things that are going on that I can see on that. So I got it predominantly from those reports. For instance, things where we had a graph that would show you the activity in the ward, and the peak time where we would have admissions were more into the evening, and yet our staffing for positions like healthcare assistants was more during the day when actually the peak wasn't there. So I would be saying, so why did we do that? You know, why aren't we changing rosters or changing times for these staff to work when the peak is there, so that you actually give nursing time to the nurses to do what they do best, which is, you know, with the patients and that, and enabling support for the nurses. So when you look at processes like that, that was significant. There are other things that came into play. Yvonne might have talked about her Super 6 concept, which is fantastic, about some staff getting together to look through some of the things that were really quick hits that we could organise and get started. And they were things like equipment on the ward, the layout of the ward, you know, and I could quickly just go, yes, go and purchase that, go and purchase this, and things like that. And I think that was one of the impacts, that actually staff could see things happening. So I was quite supportive in that process, attended a meeting or two of the Super 6, and they then engaged with the staff on the ward too in terms of the process. I think it's really important that when you embark on a process like this, that you support it from a management perspective the whole way, because if you don't, it's, you know, the inevitable is that it will fail because you don't have that support right from the top. Yvonne showed really good leadership in this too, and I need to acknowledge her, and also her service manager. But I think what I felt my role was to kind of clear the pathway for them to be able to do some of the things that they needed to do, and to be supportive of letting them have a go at trying something, whether it worked or not, but enabling them to do it. So one of the things that the reports demonstrated was that, yes, we did need some additional staffing at various times, particularly during the winter period when we have really high admissions, high acuity, high demand. And so what I was able to do was to provide for them some resourcing to enable a PM resource nurse coordinator to support the ward for a 5-month period, as well as additional HCA and clerical support, so that nurses didn't need to do some of that, that they actually went to the right skill mix that needed to do that. So over a 5-month period, I met with Yvonne and her service manager initially at the beginning of the year and said, what did you need to do? You know, if I can't give you ongoing permanent funding, let's have a look at the highest time of demand and see whether I can help you in that little bit of time, you know, because DHBs are all hit with funding and the ability to fund this or whatever. So where I was probably lucky as the lead general manager for the District Health Board was to tag some funding for winter planning. And so I tagged and got supported and approved by the CEO and the Chief Financial Officer to tag funding to support Ward 2 during that really high activity time. And I would say that you've seen what we've reaped, the benefits that we've reaped in terms of the comparative data, that just having a few extra pairs of hands have made to that ward, and it's been fantastic. You know, we haven't secured permanent ongoing funding, but what I have secured is that tagging of that money again, so come next year. Hopefully we'll be able to do the same thing, but at least what you have coming from the other end, from the staff, is that they can actually see something's happened and a follow through, and yes, if you can demonstrate this, we will follow through and we will do something about it, and I think that's great. I mean, it just builds that that, you know, the working together, the team, the collaborative approach, and that, so that's been great. I'm pretty confident. I can only see an upward surge for this ward. I think you can tell it in terms of, as I said before, when you go on the ward, you can tell, you know, there are slicker processes, slicker systems. Staff are a lot happier. They work a lot closer as a team, as a unit together, and there's good leadership on the ward. So I have no doubt at all that we've done something great. It will continue. The journey never stops. Continuous improvement is always there. And I think what we've got, though, is a workforce that will embrace any change or any innovation that comes their way now, because they've actually seen what it can actually do for them. If I've just spoken predominantly around Ward 2 in terms of what we've achieved on Ward 2, but if I can put my lead GM hat on, what we've achieved as an organisation overall within the hospital environment, I'd say that we've got a really high profile now of things that we talk about, like variance response management, processes that we're putting into place amongst all the wards in terms of, so what do you do if this happens or this demand increases, what we call the smart fives. If you come to a ward, you'll know to give assistance, you'll know actually these are the things that we would like done. You know, you might feel that you're out of your skill level or whatever like that, but don't ever be afraid of that, because all you're doing is just putting a few extra pairs of hands in a ward that's really busy, and boy does it, you know, really help along the way. We've seen it in our organisation, but the thing that I think's really made an impact is what we call the HAG screen, the hospital at a glance. Fantastic innovation. Might have had some grumbles along the way about the size of the screens in there, but I think once you take people through the reasoning around it, that you can see at a glance activity on the ward, and where one ward might need more help than another ward because you can see the level of patience in it, and to have staff say, hey, I can go and give a few hours there, and actually doing that off their own bat and not having to be rung to say we need help, just shows you the change that happens in a culture and in behaviour. So those have been big wins, I think, for our organisation, and you know, I can't underestimate how much this HAG screen to me has changed from what I always term a silo approach to an integrated whole of system approach. I think if anybody was considering, you know, embarking on the same journey as we have up in Northland, I'd say go with it. Sure, you're going to have humps and bumps along the way, issues that you have to address like data, the collection of data. Can you get staff on board, you know, to be able to input the data that you need to do the analysis and that. But what I'd say is that, look, it's all worth it in the end. What you see, I mean, what you put in is what you reap at the other end, and you will see it in the results on your wards and that. So, yep, you'll have challenges, but I tell you what, the rewards outshine all those challenges that you had along the way. It's a great process. So, unfortunately, I can't be in Tauranga, and damn, I wanted to be there because I'm so proud of what we've actually achieved in our CCDM process up here in Whangarei. I'm proud of the staff that have participated, and especially proud of Yvonne and her team and the service manager who supported her through this. And all those too that are involved in CCDM, Kieran, Rhonda, our Don, Margaret, and I just want to acknowledge them all while I can, because they've all been part of this process and have done a great job. So thank you very much, and I hope you have a great afternoon.